I went to visit a friend who was building a new home, and I went upstairs, stepped on what I thought was an attached floor. It wasn't, and I fell 14 feet onto concrete.
When Chara Schreier came to San Francisco General Hospital, it was clear that she had these very significant injuries, which included injury to her pelvis and her heel bone.
San Francisco General is the only trauma center in the city.
So if you get injured anywhere from the bridges down to the airport, you're coming here.
I went to the Public Health Center to do an overall screening, and that included HIV/AIDS, and I did the oral swab test. And the nurse came in and he said, "Oh, don't worry, honey, I've never given a positive." And 10 minutes later, his face went flush white, and I knew then that I was positive.
Angie came to us early on in her pregnancy and was very concerned about passing HIV on to her baby.
So we'll put a pin here.
San Francisco General is really a world-class institution.
We're the safety net hospital for nearly 20% of the city, and we're a major research and education institution.
We have over 150 principal investigators and around 800 people who work on this campus doing just research. None of this would be possible if we didn't have the outside support of the foundation. The support is very broad and supports many, many programs. Some examples are BAPAC, and then another example is the Orthopedic Trauma Institute.
How many of these have you done in Tanzania?
The Orthopedic Trauma Institute is one of the first programs that the foundation funded. That $150,000, the Institute has been able to leverage into tens of millions of dollars.
And the surgical training facility was one that we developed as really the first of its kind within the UC system that was going to improve the education of our own trainees. Not only our own residents of San Francisco, but for our neighbors across the globe.
Musculoskeletal problems and injuries are the second largest burden in the world of healthcare. When these patients are seen in these developing world countries with poor resources, many of these patients are just languishing on wards.
Our courses bring in these surgeons and teach them so that they can spare these limbs and return the patients back to a functional status where they can actually go back and provide for their families.
The foundation also supports BAPAC, which is a very exciting and innovative program.
This particular program works with HIV-infected pregnant women and the treatment of those women so that their babies are born free of the virus.
When I first walked into their office, Dr. Deb Cohan told me that I could have a natural birth, and I could not wrap my mind around that.
We know that for a woman who is pregnant with HIV, if we do nothing, her risk of passing HIV to her baby is about 25%. With the use of this combination antiretroviral medication, we can substantially reduce that risk to much less than 1%. BAPAC was really one of the first places to use these combination medications in pregnant women.
I'm so grateful that the medicine that they have can ensure that a baby be born healthy.
This program has been so successful that it has been 5 or 6 years now since we have had a child born at San Francisco General infected with the AIDS virus.
I have so much gratitude for their help in making sure that my daughter was healthy. I don't know if thank you would even cover that.
I have absolutely no residual pain or any residual damage. San Francisco General is a gift to San Francisco, and I am just elated that I was brought here to be treated.
We really want to thank the foundation and all of the work, the hard work that goes into supporting our programs. They do make a difference.
The San Francisco General Hospital Foundation has been a lifeline for BAPAC, and really we would not be able to do our work without the foundation.
I owe my healthy, beautiful baby girl and my new life to BAPAC, and I thank you from the bottom of my heart.